Hello, my name is Christine, and today I will be doing the ophthalmic skills video. I have no polish on my nails, no jewelry. I have all my supplies here. So I will be checking the doctor's orders and then verifying the 6 rights, which is the right dose, patient, time, medication, drug, and documentation, and route. Next, I will be checking the EHR with the medication. The medication order says here timolol 0.25%, 1 drop in each eye twice daily. So I verify that's correct, and I will gather all my supplies and enter my patient's room. Knock on the door, enter, close the curtains for patient privacy, perform hand hygiene. Hello there, my name is Christine. I'll be your nurse today. Can I get your first and last name and date of birth? I verify my patient with their wristband. Okay, so today I'm here to give you your eye medication. It's going to take approximately 5 minutes. Do you have any known allergies? No known allergies. Okay, great. The medication today is timolol 0.25%. It is going to help with your glaucoma, the pressure into your eye. Common side effects are dizziness and fatigue. When I do drop the medication into your eye, you might feel a little bit of stinginess, and the adverse side effects will be shortness of breath and slow heart rate. When that happens, please let me know immediately. Do you have any questions for me? No? Okay. So now I will be performing hand hygiene and then putting on a pair of clean gloves. I will then help my patient get into a comfy supine position. I will raise the bed up, lower the side rails. I can also do this while the patient is seated, just with their head and neck slightly hyperextended. Next, I will assess my patient and check their eyes for any eye crusties. If I see any eye crusties, I will take a clean rag with some warm water. I will press gently onto their eye, like this, and then I'm gonna let it soak for 1 to 2 minutes. After 1 to 2 minutes, I will gently remove the rag press the rag from the inner campus to the outer campus to remove the eye crusties. Okay, and then I'll do the same thing for the other eye. I'll take a clean part of the rag, same thing, I'll let it sit for 1 to 2 minutes. Let the eye soak very gently, and then I will wipe it from the inner campus to the outer campus. Okay, and then I will dispose of this. Now my patient is ready. I will take off these gloves and then perform hand hygiene, and then I will put on some new pair of gloves. So with my non-dominant hand, I'll be grabbing this gauze, and then I'm gonna put it on the bony orbital part of their cheek. And with my thumb, I'm gonna gently press down to expose the conjunctival sac, like this. So I'm just gonna press down, like this. And then I'm gonna grab my medication. I will be, and then resting my hand gently onto their forehead. I will ask the patient to look up. Okay, go ahead and look up. I will be dropping 1 drop into your eye, solid drop, and still 1 drop into their conjunctival sac, which is 1 to 2 centimeters below. I want to make sure the patient doesn't blink, and then that the medication does go into their eye. If there is a systemic effect, I will take the gauze and put it in the nasal lacrimal duct and hold it there for 30 to 60 seconds. Okay, so I was able to instill the 1 drop into their eye, and I'll do the same thing with their opposite eye, the other eye. Same thing, I'll put this gauze, I'll press down gently with my thumb. I have my patient look up, go ahead and look up. Rest my hand gently onto their forehead. I'm gonna instill 1 drop, which is 1 to 2 centimeters above their conjunctival sac. Okay, same thing, if there are any systemic effect, I will hold the gauze in the nasal lacrimal duct for 30 to 60 seconds. Okay. Okay, so I was able to instill 1 drop in each eye in my patient. So now I will put I'll dispose of this. I'm gonna take off my gloves. Throw this away, perform hand hygiene. I will help my patient get up into a comfy position. Make sure the bed is lowered and the side rails are up. All right, we're all set here. Let me know if you have any questions. Here's a call light. Let us know if you need anything. So now I'm gonna go ahead and document the procedure with the 6 rights: patient, drug, dose, time, route, and documentation.